One thing that came up, I was reading about in my emails from ASPS was how young is too young to get a facelift?
It's tough. I think it's individualized. It's also patient expectation and individual differences. So I think it's younger and younger. What were they saying? Usually it used to be in the procedure to get done in your 60s.
Yeah, when I first started out, if someone in their 40s or like early 50s came, I'm like, yeah, maybe in another 10 years, you might need it. Although in Arizona, it's younger because of the sun-damaged skin. But now, like for the best results with what people are looking for, you're gonna get the best results at a younger age, at 30s and 40s, where the elasticities in the skin and what you're doing, everything you're doing with a facelift, what we do, like some other people just try to pull on the skin.
Yeah.
It's building the structure underneath, reshaping the structures that are underneath, not just pulling on the skin where you get that Joker look or something.
And the skin can gain elasticity, and one or two bad facelifts, by the time you're 60, you are going to look a little funny. But if you get the deeper structures that have the strength, then you're going to get longer lasting results. It's going to look more natural too. I think that's one big thing is like shifting quite a bit in plastic surgeries. People want more natural look.
If you're placing the fat back to where it belongs and where it did look, or where it was when they were like in their 20s or in their teens or like early 30s. So you're just taking the fat, moving it around, releasing some of the ligaments and reattaching it in new places to be able to get that look. And then you remove a small amount of skin. It's not much skin.
Yeah,
removal.
It really isn't at all. Like older patients in their 60s and 70s, you're expecting to remove much, and you're like, oh no, it doesn't take much.
What I can't understand is all these people that are, doing 10 cc's of like Juvederm or any sort of filler. And like, they're like minimally invasive facelift. And I'm like, how long is it lasting? It's not even lasting 2 years. And you're paying all this money for putting all this synthetic stuff in your face.
Yeah, because if you're getting 10 cc's, 2 sessions, it's pretty much going to possibly pay for it.
Yeah, and then they're doing skin tightening and stuff. And then you got all this scar tissue for a facelift. Not that we can't do it. It just creates a mess. And, are you going to do that every 2 years? You're going to go in for like this $10,000, $15,000 non or minimally invasive facelift. I'm like, yeah, they look great, but how long does it last?
Well, they say 2 years, right? If you do it repeatedly, you can build an immune response, right? And
yeah.
Your body like crushes it. It's sometimes like 6 months to 12 months.
Yeah. And the treatment's got to be tailored to you, and like they're using, how many times are they going to be able to use radio frequency on your skin to get that like tightness, after the first time you do it, maybe they can do it 1 or 2 more times. If you get a facelift, you get 10 to 15 years out of it if you get a good facelift, and it's got to be tailored to you. Like some people have a lot of skin laxity. The ways to do it is you got to move the structures around, give them the youthful look back. And then a lot of times you do need some external device to tighten up the skin even further to give them the best possible.
But you're not
look.
saying tighten it up surgically as that follow-up. So it's like a combination facelift with just skin treatments.
Yeah, skin treatment. There's like radio frequency. I like the Renuvian, either external or internal on the face. There's the Croton peel, some of the deeper chemical peels that you can get. You have to be under anesthesia to get them, but they have some amazing results. Most of them look better than all these like $300,000 lasers that people are using. So
yeah, I would say that. Another thing I always talk to patients that come in to discuss facelifts and stuff is facial fat grafting. Because with like 50 mLs to 100 mLs, you're going to get such a drastic change. Because you keep mentioning about moving the structures around. Part of that's replacing the fat where it belongs.
You got to be very careful with fat grafting. Once you reposition the fat pads and everything, you really don't need that much fat.
Well, I'm saying like 50 cc's, 100 cc's, you're going to get like wide areas of forehead, brows, periorbital areas, cheekbones, potentially nose, nasolabial folds.
Yeah, especially with Ozempic now, like a lot of people don't want to undergo a facelift. Although I recommend that as the first choice. But if they don't want to do it, yeah, you can inject fat to rebuild that. But it like never overfill, just do the appropriate amount just to make it look natural, because overfilling, then once you go to reposition, it's going to, you know, once they get the facelift, it's going to look horrible.
It's just going to look weird because there's just fat and where
but the good part about fat is you're going to also induce collagen building within the skin. So it rejuvenates the skin as well.